Welcome to this video where we will be discussing IgA nephropathy, also known as Berger's disease, a common kidney disease that can lead to kidney failure if left untreated. We'll explore its causes, symptoms, diagnosis, and management, giving you a comprehensive understanding of this condition. The exact cause of IgA nephropathy isn't fully understood, but it's believed to be a combination of genetic predisposition and environmental triggers. Certain genes increase the risk of developing the disease. Environmental factors such as infections, particularly respiratory infections like tonsillitis, can trigger or worsen the condition. Diet and gut bacteria also seem to play a role, influencing the immune system's response. Essentially, it's a complex interplay of factors that disrupt the normal immune function and lead to the deposition of IgA in the kidneys. IgA nephropathy is characterized by the buildup of immunoglobulin A or IgA antibodies in the glomeruli, the tiny filters in your kidneys. Normally, IgA helps fight infections. However, in IgA nephropathy, abnormal IgA forms, leading to its deposition in the glomeruli. This deposition triggers an inflammatory response, damaging the glomeruli over time. As the glomeruli become scarred and damaged, they lose their ability to filter waste products from the blood effectively, leading to protein in the urine, eventually kidney failure in some individuals. IgA nephropathy is the most common form of glomerulonephritis worldwide. It affects people of all ages, but it's most frequently diagnosed in young adults between their teens and 30s. While it occurs globally, certain populations have a higher prevalence, including those of Asian and European descent. Men are also affected more often than women. However, anyone can develop the condition, regardless of their background. Often, IgA nephropathy progresses slowly over many years without noticeable symptoms. The first sign is often hematuria, or blood in the urine, which may be microscopic or visible. This is often triggered by an upper respiratory infection or strenuous exercise. Other symptoms can include proteinuria or protein in the urine, which can lead to foamy urine. Over time, as kidney function declines, patients may develop high blood pressure, swelling in the hands and feet, edema, and fatigue. In advanced cases, symptoms of kidney failure, such as nausea, vomiting, and loss of appetite, may appear. Diagnosis of IgA nephropathy typically involves several tests. A urinalysis can detect blood and protein in the urine. A blood test will evaluate kidney function and measure creatinine and urea levels. However, the definitive diagnosis requires a kidney biopsy. During this procedure, a small sample of kidney tissue is removed and examined under a microscope to confirm the presence of IgA deposits in the glomeruli. The biopsy also helps determine the extent of kidney damage. While IgA nephropathy isn't typically classified into distinct types, its severity and progression can vary widely. The Oxford classification, also known as the MSDC score, is used to assess the pathological features observed in the kidney biopsy and predict the risk of disease progression. This score considers factors such as mesangial hypercellularity, endocapillary hypercellularity, segmental glomerulosclerosis, tubular atrophy, interstitial fibrosis, Crescent's incomplement C40 deposition. The MSDC score helps guide treatment decisions and predict long-term outcomes. There is no cure for IgA nephropathy, but treatment aims to slow the progression of the disease and manage symptoms. Management strategies include medications to lower blood pressure, specifically ACE inhibitors or ARBs, which can also reduce protein in the urine. Corticosteroids, such as prednisone, may be used to suppress the immune system and reduce inflammation, although their use is carefully considered due to potential side effects. In some cases, immunosuppressants like cyclophosphamide or azathioprine might be necessary. Dietary modifications, such as reducing sodium and protein intake, can also help manage the condition. Omega-3 fatty acid supplementation has been shown to be potentially beneficial. Regular monitoring of kidney function is essential to adjust treatment as needed. For advanced kidney failure, dialysis or kidney transplantation may be necessary. Unfortunately, there's no known way to definitively prevent nephropathy. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can support overall kidney health. Prompt treatment of respiratory infections, particularly tonsillitis, may potentially reduce the risk of triggering or worsening the condition, but this area requires more research. It's also crucial for individuals with a family history of IgA nephropathy to be aware of the potential risk and undergo regular check-ups to detect any signs of kidney problems early. The prognosis for IgA nephropathy varies significantly from person to person. Some individuals may experience a slow progression and maintain relatively normal kidney function for many years, while others may develop kidney failure more rapidly. Factors that can affect the prognosis include the severity of the disease at diagnosis, the presence of high blood pressure, the amount of protein in the urine, and the response to treatment. Recent research is focusing on identifying biomarkers that can predict disease progression and developing more targeted therapies. Novel approaches being investigated include complement inhibitors and targeted IgA therapies, with the hope of providing more effective treatments in the future.